Teamwork is the best way to approach many things in life, and our first guests this morning are taking the team approach to cosmetic dentistry. They provide amazing results with their patients. We welcome this morning Dr. Stephen Ghim, who specializes in adult cosmetic dentistry, along with Dr. Grant Coleman from Hull & Coleman Orthodontics and Dr. Eric Kerr from Charlotte Periodontics. And good morning to all three of you. Thank you so much for being here today.
Morning. Thanks for having us.
Thanks for having us.
Of course, it's great to see you again. We should mention the three of you, you are a team. You work together as a team. All of you are continuously nominated as the top dentists in your fields by your peers. Why do you think that team dentistry is the best approach?
Well, we want to let the public know that not every patient needs the team approach in cosmetic dentistry. However, when a general dentist that provides quite a bit of cosmetic dentistry sees a need for a specialty to intervene and help with the final case, then we have to make that decision to help that patient receive the best results.
What are the benefits for the patients from this team approach?
Sure. I get a lot of patients where I'll send to Grant and he'll have to move the teeth around for better positioning. Eric will go ahead and take a look at the gum tissues to make sure they're in the same position. So they're lining everything up for me so I can come in and provide the final veneers or crowns so when the patient smiles, everything looks symmetrical and really beautiful.
And that means you get a great result. Okay, let's take a look at one of your cases, Dr.
Sure.
Ghim. We'll put it up on the screen right now. This is something that you took a team approach on. Talk about what we're looking at here.
Well, this is just the upper and lower front teeth. And, there's just a myriad of things that what I'm looking at. And really, once I saw that, I knew that Dr. Coleman and Dr. Kerr would have to help me out here with some proportions and changing the shapes of the teeth, the locations and the position so I could get a better result in the end.
Okay, so Dr. Coleman, what was your role in this case?
So in this case, the lady that came in had a condition where her upper and lower teeth were hitting directly on top of each other, and if you look at the upper teeth, she had really damaged her teeth over time from the improper contact, and Dr. Ghim knew that there was no way he could restore those teeth in the position that they were in, so my job was to correct the fit of the teeth so that they would meet properly so that he could then do his restorative dentistry. Without moving the teeth, he would have had to do some pretty aggressive work on the upper and lower teeth, but by moving them into the correct position, we were able to keep it much more conservative and do better and simpler work.
Yeah, I bet you're glad you've got your guys here with you, right? Right?
Definitely.
Dr. Kerr, what about you? What was your role in this?
My role was twofold. First, to establish health of the gum tissue and of the supporting bone around the teeth to be able to maintain that long term, and secondarily to provide the frame in which Dr. Ghim can provide the restorative dentistry, where he can provide the crowns and the restorations and get things placed where they need to. So to establish health and then to maintain the frame of the health of the tissue around those restorations.
So Dr. Ghim, after they're done with their portion, that's when you can, as you mentioned earlier, do the veneers and the crowns and finish what you need to do.
That's right. Initially, the three of us will go ahead and come together and we'll talk and discuss with pictures on how we'll see the final result and really reverse engineering the case. And then once they finish their job, the patient comes back to me, and then that's where we'll provide the crowns or veneers or whatever we have treatment planned.
Take a look at that picture right there. Yeah, how long does something like this take? I mean, what is the entire treatment process? I'm thinking months and months and months, probably, right?
It depends on a case-by-case basis, and, Shirley Grant and I have been doing many cases with Eric, and 12 to 15 months, depending on what the patient's looking for.
And as you mentioned earlier, too, Dr. Ghim, not every patient who comes in to see you needs this team approach. Again, it's decided on a case-by-case basis.
Yeah, and I could send something to Grant or even Eric, and they could come back and say, hey, I think you could, I don't need to do this procedure. Why don't you go ahead and proceed? So I want to rule out all options before I proceed.
How do you communicate with each other about this team approach and what work needs to be done? I mean, are we conference calling? How does that all work?
Eric, pictures. We do a lot of pictures.
Email, text, phone call, a lot of visualization. We've got to be able to see what we're talking about. So a lot of times getting together in person is the best way to communicate, but we use every mode available to be able to communicate effectively.
If we can take a look at that final result one more time, if we can put that picture back up on the screen, you can see it really does make a huge difference when they take this team approach. Nicely done, gentlemen. Good job. Good work that you're doing. Thank you so much. We're glad that you're all here today.
Thanks for having us.
Thanks for having us.
Well, to learn more, call Dr. Stephen Ghim at 704-935-2700. Again, 704-935-2700, or visit his website. It's drstephenghim.com. Note the spelling on your screen, drstephenghim.com. He has a lovely office in the Blakeney area. I've been there a few times. Great to see you all. Thanks for being here.
Thanks for having us.
Thank you.
Thank you.